Hey Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 20 practice questions. Without the way, let's get started. Hey Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 20 practice questions. Without the way, let's get started. Hey Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 20 practice questions. Without the way, let's get started. You can check out my study guides and reviews. Links will be in the description. Thank you for watching. Hey Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 20 practice questions. Without the way, let's get started.
The staff nurse is working with a student nurse to provide care for a 10-year-old patient with severe abdominal, hip, and knee pain caused by a sickle cell crisis. Which action taken by the student requires the staff nurse to intervene immediately? 1. Administering oral pain medication as needed. 2. Positioning cold packs on the child's knees. 3. Encouraging increased fluid intake. 4. Monitoring vital signs every 2 hours. The correct answer is 2. Positioning cold packs on the child's knees. Sickle cell crisis may include vaso-occlusive crisis, splenic sequestration, and aplastic crisis. The symptoms experienced by this child are indicative of both vaso-occlusive crisis and splenic sequestration. Placing cold packs on the knees of a child with vaso-occlusive crisis results in vasoconstriction, placing the child at risk for thrombosis formation. Encouraging increased fluid intake is advised to prevent thrombosis formation. Monitoring vital signs is a method to assess for life-threatening complications associated with both vaso-occlusive crisis and splenic sequestration. Vaso-occlusive crisis is associated with severe pain, and pain medication is recommended. After receiving the change of shift report, which patient should the nurse assess first? 1. An 18-month-old patient with coarctation of the aorta who has decreased pedal pulses. 2. A 3-year-old patient with rheumatic fever who reports severe knee pain. 3. A 5-year-old patient with endocarditis who has crackles audible throughout both lungs. 4. An 8-year-old patient with Kawasaki disease who has a temperature of 102.2 degrees Fahrenheit. The correct answer is 3. A 5-year-old patient with endocarditis who has crackles audible throughout both lungs. Crackles throughout both lungs indicate that the child has severe left ventricular failure as a complication of endocarditis. Hypoxemia is likely, so the child needs rapid assessment of oxygen saturation, initiation of supplemental oxygen delivery, and administration of medications such as diuretics. The other children should also be assessed as quickly as possible, but they are not experiencing life-threatening complications of their medical diagnoses. The nurse obtains this information when assessing a 3-year-old patient with uncorrected tetralogy of Fallot who is crying. Which finding requires immediate action? 1. The apical pulse rate is 118 beats per minute. 2. A loud systolic murmur is heard in the pulmonic area. 3. There is marked clubbing of the child's nail beds. 4. The lips and oral mucosa are dusky in color. The correct answer is 4. The lips and oral mucosa are dusky in color. Circumoral cyanosis indicates a drop in the partial pressure of oxygen that may precipitate seizures and loss of consciousness. The nurse should rapidly place the child in a knee-chest position, administer oxygen, and take steps to calm the child. The other assessment data are expected in a child with congenital heart defects, such as tetralogy of Fallot. The nurse is providing nursing care for a newborn infant with respiratory distress syndrome who is receiving nasal continuous positive airway pressure ventilation. Which assessment finding is most important to report to the healthcare provider? 1. Apical pulse rate of 156 beats per minute. 2. Crackles audible in both lungs. 3. Tracheal deviation to the right. 4. Oxygen saturation of 93%. The correct answer is 3. Tracheal deviation to the right. Tracheal deviation suggests tension pneumothorax, a possible complication of positive pressure ventilation. The nurse will need to communicate rapidly with the HCP and assist with actions such as chest tube insertion. The heart rate, crackles, and oxygen saturation will be reported to the HCP, but are expected in RDS and do not require immediate intervention. An adolescent with cystic fibrosis is admitted to the pediatric unit with increased shortness of breath and pneumonia. Which nursing activity is most important to include in the patient's care? 1. Allowing the adolescent to decide if aerosolized medications are needed. 2. Scheduling postural drainage and a chest physiotherapy every 4 hours. 3. Placing the adolescent in a room with another adolescent with CF. 4. Encouraging oral fluid intake of 2,400 milliliters per day. The correct answer is 2. Scheduling postural drainage and a chest physiotherapy every 4 hours. National guidelines indicate that airway clearance techniques are critical for patients with CF. Thus, postural drainage and chest physiotherapy are a priority. National guidelines also indicate that children and adolescents with CF who are hospitalized with respiratory illnesses should be placed on contact precautions. Furthermore, people with CF should be separated from others with CF to reduce droplet transmission of CF pathogens. There is no evidence that increased fluid intake adequately thins respiratory secretions, and chest physiotherapy is the priority. An unimmunized 7-year-old child who attends a local elementary school contracts rubeola. The child has 2 siblings, ages 9 and 11 years, who also attend the elementary school. Which action by the school nurse is a priority? 1. Exclude the child and siblings from attending school for 21 days. 2. Notify all parents of children attending the school of the exposure. 3. Recommend that the siblings receive the measles vaccine. 4. Recommend that the siblings receive measles immunoglobulin. The correct answer is 1. Exclude the child and siblings from attending school for 21 days. Rubeola is a highly contagious infectious disease with severe consequences that include death. The Centers for Disease Control and Prevention reports that 9 of 10 susceptible people with close contact to a person with measles will contract the disease. The incubation period is 7 to 21 days. Excluding the infected and exposed children during this period of time is a priority to prevent exposure of healthy children enrolled in the elementary school. Although it is important to notify the parents of the other children in the school of the exposure, limiting exposure of other children is the priority. Mumps, measles, and rubella vaccine administered within 72 hours of initial measles exposure and immunoglobulin administered within 6 days of exposure may provide some protection or modify the clinical course of the disease in unimmunized children. However, the priority is to prevent an epidemic by limiting exposure. A 4-month-old infant boy is brought to the emergency department by his parents. He has been vomiting and fussy for the past 24 hours. On examination, there are circular bruises on his back. What priority assessment does the nurse anticipate? 1. Chest X-ray examination. 2. Ultrasonography of the head. 3. Electroencephalography. 4. Ophthalmologic examination. The correct answer is 4. Ophthalmologic examination. The history and physical examination suggest shaken baby syndrome. An ophthalmologic examination is indicated to determine if the infant has retinal hemorrhages characteristic of shaken baby syndrome. Electroencephalography may be indicated if there is evidence of seizures. Magnetic resonance imaging or computed tomography of the head can detect subdural hematomas. There is no evidence that would support the need for a chest X-ray examination. The pediatric unit charge nurse is making patient assignments for the evening shift. Which patient is most appropriate to assign to an experienced LPN/LVN? 1. A 1-year-old patient with severe combined immunodeficiency disease who is scheduled to receive chemotherapy in preparation for a stem cell transplant. 2. A 2-year-old patient with Wiskott-Aldrich syndrome who has orders for a platelet transfusion. 3. A 3-year-old patient who has chronic graft versus host disease and is incontinent of loose stools. 4. A 6-year-old patient who received chemotherapy 1 week ago and is admitted with increasing lethargy and a temperature of 101 degrees Fahrenheit. The correct answer is 3. a 3-year-old patient who has chronic graft versus host disease and is incontinent of loose stools. LPN/LVN scope of practice includes the care of patients with chronic and stable health problems, such as the patient with chronic graft versus host disease. Chemotherapy medications are considered high-alert medications and should be given by RNs who have received additional education in chemotherapy administration. Platelets and other blood products should be given by RNs. The 6-year-old patient has a history and clinical manifestations consistent with neutropenia and sepsis and should be assessed by an RN as quickly as possible. A 6-year-old child who received chemotherapy and had anorexia is now cheerfully eating peanut butter, yogurt, and applesauce. When the mother arrives, the child refuses to eat and throws the dish on the floor. What is the nurse's best response to this behavior? 1. Remind the child that foods tasted good today and will help her or his body to get strong. 2. Allow the mother and child time alone to review and control the behavior. 3. Ask the mother to leave until the child can finish eating and then invite her back. 4. Explain to the mother that the behavior could be a normal expression of anger. The correct answer is 4. Explain to the mother that the behavior could be a normal expression of anger. Help the mother to understand that the child may be angry about being left in the hospital or about her inability to prevent the illness and protect the child. Reminding the child about the food and the purpose of the food does not address the strong emotions underlying the outburst. Allowing the mother and child time alone is a possibility, but the assumption would be that the mother understands the child's behavior and is prepared to deal with the behavior in a constructive manner. Asking the mother to leave the child suggests that the mother is a source of stress. A 3-month-old infant arrives at the health center for a scheduled well child visit. The parents ask the nurse why the infant extends the arms and legs in response to a loud sound. Which response by the nurse is best? 1. Inform the parents that this is a normal reflex that generally disappears by 4 to 6 months of age. 2. Tell the parents if the behavior does not change by 6 months, the infant will need further evaluation. 3. Remind the parents this is a normal response that indicates the infant's hearing is intact. 4. Reassure the parents that the behavior is normal and not an indicator of any problem such as cerebral palsy. The correct answer is 1. Inform the parents that this is a normal reflex that generally disappears by 4 to 6 months of age. The infant's behavior is consistent with the Moro and startle reflexes. The Moro reflex usually disappears by 6 months of age. The startle reflex usually disappears by 4 months of age. A hearing test is not based on response to loud sounds alone. Although it is true that further evaluation may be needed if the reflexes do not disappear, there is no need for the nurse to discuss this with the parents at this time. The infant's behavior is not consistent with cerebral palsy. The nurse has just received a change of shift report about these pediatric patients. Which patient will the nurse assess first? 1. A 1-year-old patient with hemophilia B who was admitted because of decreased responsiveness. 2. A 3-year-old patient with von Willebrand disease who has a dose of desmopressin scheduled. 3. A 7-year-old patient with acute lymphocytic leukemia who has chemotherapy-induced thrombocytopenia. 4. A 16-year-old patient with sickle cell disease who reports acute right lower quadrant abdominal pain. The correct answer is 1. A 1-year-old patient with hemophilia B who was admitted because of decreased responsiveness. Because decreased responsiveness in a 1-year-old patient with a clotting disorder may indicate intracerebral bleeding, this patient should be assessed immediately. The other patients also require assessments or interventions, but are not at immediate risk for life-threatening or disabling complications. The nurse is obtaining the history and physical information for a child who is recovering from Kawasaki disease and receives aspirin therapy. Which information concerns the nurse the most? 1. The child attends a daycare center 5 days a week. 2. The child's fingers have areas of peeling skin. 3. The child is very irritable and cries frequently. 4. The child has not received any immunizations. The correct answer is 4. The child has not received any immunizations. Children who receive aspirin therapy are at risk for the development of Reyes syndrome if they contract viral illnesses such as varicella or influenza, so the lack of immunization is the greatest concern for this child. Peeling skin on the fingers and toes and irritability are consistent with Kawasaki disease, but do not require any change in therapy. Because Kawasaki disease is not a communicable disease, there is no risk for transmission to other children in the daycare. The nurse is observing a preschool classroom of children between the ages of 3 to 4 years of age. When planning actions to ensure that each child meets normal developmental goals, which child will require the most immediate intervention? 1. A 3-year-old boy who needs help dressing. 2. A 4-year-old girl who has an imaginary friend. 3. A 4-year-old girl who engages only in parallel play. 4. A 3-year-old boy who draws stick figures. The correct answer is 3. A 4-year-old girl who engages only in parallel play. At 4 years of age, children engage in pretend play. Parallel play is seen in younger children between the ages of 2 and 3 years when they play side by side with limited interaction. The other behaviors are developmentally appropriate. The nurse will plan interventions to ensure that all the children meet developmental goals, but the 4-year-old child engaging only in parallel play will require the most immediate intervention. The nurse is assisting with the delivery of a 31-week gestational age premature newborn who requires intubation for respiratory distress syndrome. Which medication does the nurse anticipate will be needed first for this infant? 1. Theophylline. 2. Surfactant. 3. Dexamethasone. 4. Albuterol. The correct answer is 2. Surfactant. Research indicates that the administration of synthetic surfactant improves respiratory status and decreases the incidence of pneumothorax in premature infants with RDS. The other medications may be used if respiratory distress persists, but the first medication administered will be the surfactant. The nurse has obtained this assessment information about a 3-year-old patient who has just returned to the pediatric unit after having a tonsillectomy. Which finding requires the most immediate follow-up? 1. Frequent swallowing. 2. Hypotonic bowel sounds. 3. Reports of a sore throat. 4. Heart rate of 112 beats per minute. The correct answer is 1. Frequent swallowing. Frequent swallowing after a tonsillectomy may indicate bleeding. The nurse should inspect the back of the throat for evidence of bleeding. The other assessment results are expected in a 3-year-old child after surgery. The school nurse is performing developmental screenings for children who will be entering preschool. A 4-year-old girl excitedly tells the nurse about her recent birthday party. As she relates the details of the event, she frequently stutters. Which action by the nurse is most appropriate at this time? 1. Refer the child to an audiologist. 2. Obtain a detailed birth history from the parents. 3. Document the findings on the child's school record. 4. Refer the child to a speech pathologist. The correct answer is 3. Document the findings on the child's school record. Stuttering during the preschool years is a normal variation, particularly when excited or upset. The cause is attributed to preschool children increased cognitive abilities and imagination such that their speech cannot keep up with their thoughts. Documenting this on the child's record is important for continued observation to determine if it extends beyond the preschool years. While working in the pediatric clinic, the nurse receives a telephone call from the parent of a 13-year-old child who is receiving chemotherapy for leukemia. The patient's sibling has chickenpox. Which action will the nurse anticipate taking next? 1. Administer varicella-zoster immune globulin to the patient. 2. Teach the parent about the correct use of acyclovir. 3. Educate the parent about contact and airborne precautions. 4. Prepare to admit the patient to a private room in the hospital. The correct answer is 1. Administer varicella-zoster immune globulin to the patient. The administration of varicella-zoster immune globulin can prevent the development of varicella in immunosuppressed patients and will typically be prescribed. A cyclovir therapy and hospitalization may be required if the child develops a varicella-zoster virus infection. Contact and airborne precautions will be implemented to prevent the spread of infection to other children if the child is hospitalized with varicella. The nurse is preparing to care for a 6-year-old child who has just undergone allogenic stem cell transplantation. Which nursing tasks should the nurse delegate to the assistive personnel? Select all that apply. 1. Stocking the child's room with standard personal protective equipment items. 2. Teaching the child to perform thorough hand washing after using the bathroom. 3. Reminding the child to wear a face mask outside of the hospital room. 4. Assessing the child's oral cavity for signs and symptoms of infection. 5. Talking to the family members about the ways to reduce risk of infection. 6. Talk to the parents about local community and healthcare resources that will support the family after discharge. The correct answers are 1. Stocking the child's room with standard personal protective equipment items, and 3. Reminding the child to wear a face mask outside of the hospital room. Because all patient care staff members should be familiar with standard personal protective equipment, an AP will be able to stock the room. Reminding the child to wear a face mask is also a task that can be done by an AP, although the nurse is responsible for the initial teaching. Initially, teaching the child a good hand-washing technique, nursing assessments, and family education is within the scope of the nurse and not an AP. Talking to the family about local resources post-discharge should be done by either the nurse or the social services department. An 18-month-old child has oral mucositis secondary to chemotherapy. Which task should the nurse delegate to the assistive personnel? 1. Reporting evidence of severe mucosal ulceration. 2. Assisting the child in swishing and spitting mouthwash. 3. Assessing the child's ability and willingness to drink through a straw. 4. Feeding the child a bland, moist, soft diet. The correct answer is 4. Feeding the child a bland, moist, soft diet. Helping the child to eat is within the scope of responsibilities for an AP. Assessing ability and willingness to drink and checking for extent of mucosal ulceration are the responsibilities of a nurse. An 18-month-old child is not able to swish and spit, which could result in swallowing the mouthwash. Mouthwash is not intended for swallowing because it can contain alcohol and other ingredients not safe for ingestion. A 7-month-old infant arrives at the health center for a scheduled well-child visit. When the nurse approaches the infant to obtain vital signs, the infant cries vigorously and clings fearfully to the mother. Which of the following phenomena provides the best explanation for the infant's behavior? 1. Separation anxiety. 2. Dissociation disorder. 3. Stranger anxiety. 4. Autism spectrum. The correct answer is 3. Stranger anxiety. This infant is displaying stranger anxiety. The child becomes anxious when exposed to unfamiliar people. Separation anxiety occurs when the child is separated from the primary caregiver. Anxiety and crying are also common behaviors. Stranger anxiety and separation anxiety are concurrent and generally begin at 7 to 8 months of age.
You can get my NCLEX review course. Links will be in the description. I'll see you guys in the next video.